So when we think major global health threats, the first things that come to mind are generally infectious disease pandemics, maybe caused by Ebola or more likely a respiratory illness like influenza or even a well-known bacteria that has seen a resurgence due to antimicrobial resistance. Maybe you thought of a bioterrorist attack through an intentional release of smallpox or anthrax. Or of course there's climate change, which is even now leading to water and food shortages and increased natural disasters, too often affecting already vulnerable populations. These are all examples of collective health security, threats against entire populations which can be mitigated by governments through careful preparedness, response and recovery plans. These collective health issues intertwine with what we refer to as individual health security. Individual health is considered a person's access to safe and effective health services, products, and technologies. Issues include universal health coverage and access to vaccines and medicines for low-income countries and marginalized populations such as people living with HIV. At the individual level, the global health community is focused increasingly on non-communicable diseases like obesity, heart disease, and mental health. Drowning in children under 5 in some countries has overtaken the burden of infectious diseases. Violence, gendered or otherwise, and road traffic accidents contribute to the high numbers of preventable mortality and morbidity that we still see today. For those outside the health community, it can often be difficult to communicate why these issues are so political and why they are so challenging to solve. At the Centre on Global Health Security, we examine key global health challenges and how they manifest themselves as foreign policy and international affairs problems.